Welcome, class, to the Week 3 presentation for ME105 Medical Terminology. This week we do have 3 chapters to focus on. I know that's a lot to read, but it's all really important information, so please make sure before you do the weekly work that you have read the chapters, and then this presentation will help reiterate the most important highlights to help you prepare for your quiz. Chapter 5 focuses on dermatology. Basically the integumentary system, fancy word for hair, skin, and nails. Chapter 6 is ortho, which we're focusing on the muscular skeletal system. Chapter 7, we are going to hone in on the cardiovascular system, mainly focusing on the heart, because I believe next week we go into blood a little bit more, if I remember correctly. What's on the inside counts. So the skeletal system, first of all, just like the framework of this house here, is the framework of your body. It also acts as our strong man that we see in the middle here, which helps to support and protect our internal organs. The joints work in conjunction with muscles, ligaments, and tendons to make movement possible, as we see with Our Lady running. Calcium is stored in the bones, something we often forget. This is required for normal nerve and muscle function. So the chemical element for calcium is that Ca. It is very important. And red bone marrow is located in the spongy portion of the bone. It's important to the formation of blood cells. Moving right in, we're going to focus on joints first. This joint or articulation attaches the thigh bone to the 2 lower leg bones. Cartilage, which is a term to know, covers the end of the opposing bones, and a fat pad or bursa are the protective cushions, and the muscles make it possible to bend the knee. 2 bones are held tightly together by what's called ligaments. One term to know, well, actually 2 terms to know. The abbreviation TKA stands for total knee arthroplasty. An arthroplasty means that you're going to investigate the interior of a joint and usually do some sort of repair on it. And total knee arthroplasty is what we sometimes refer to as a total knee replacement, where we will put in a metallic or even possibly a hard plastic joint to substitute for the bone that might be diseased or damaged. Chondromalacia, that is a big mouthful, but it is an important word to know. It means abnormal softening. That's the malacia. And chondros are going to refer to cartilage. So this is abnormal softening of the cartilage. Looking at our skeleton broken down into pieces as if we were built by Legos, here's kind of how the breakdown happens. Our skull is consisted of our cranium, which is 8 bones, and our facial bones, which are 14. We do have 3 bones that are found in our ear. They're known as the auditory ossicles. Again, there's 3 of them. The thoracic cavity, mainly made up of our ribs and sternum, also our thoracic vertebra. Our shoulder, the clavicle, scapula. Sometimes we put the humerus in the shoulder area as well. Mainly the humerus does go with our arm. Our radius and ulna are our forearm bones. Our wrist, hand, and fingers, we are looking at 8 carpals, which are our wrist bones, 5 metacarpals that make up the palm of our hand, and 14 phalanges. Phalanges are the technical term for our fingers. The spinal column, 26 vertebrae now in all. It can be divided into cervical, thoracic, and lumbar regions, and then attached to our end of that, we have our sacrum and coccyx. Our pelvis is made up of an ilium, ischium, and pubic bone. The leg can be made up in terms of our thigh bone, which is our femur, our patella, which is our kneecap. Our tibia and fibula are our lower leg bones. Our foot is made up of a lot of bones, believe it or not. The talus, the calcaneus, which is another fancy word for our heel, the tarsals, there's 7 of them, the metatarsals, 5 of those, and our toes have the same name as our fingers, phalanges, and there are 14 of those. A couple other terms that I know your quiz throws at you. Hand bones are called the metacarpus, if we're referring just in general to the hand bones. Foot bones are referred to as the metatarsus. Let's look next at fractures. There's many different types of fractures in terms of what the bone does, but there's basically three general classifications in terms of the severity of the fractures. Fractures are classified as complete or incomplete, and they are described as open, which is known as compound, or closed. In an incomplete fracture, the bone is only partially broken. In a complete fracture, the bone is completely broken but does not penetrate or break the skin. In a compound fracture, the bone breaks through the skin. Not pictured on this slide because it's a specific type of fracture, but it is one I want you to know is comminuted. And that means that it's a fracture where the bone is actually shattered into many pieces. There's many ways to treat a fracture, but generally we'll classify it as closed reduction or open reduction. Closed reduction is where someone will manipulate the bone to realign it, and then generally a cast is applied. Open reduction requires a surgery where we're going to physically open the skin, go to the bone, realign the bone fragments, and then either surgically put in some screws, or once it's realigned by opening it surgically, then we can close it and put a cast on. Bone marrow. Okay, so bone marrow is important. A couple of terms to know here. Osteogenic means bone producing. That is a word I want you to remember. Blood cells are produced by the red bone marrow, and that's another important tidbit to remember on how important our bones are to our body as a whole. We are next going to look at some conditions involving the musculoskeletal area. Carpal tunnel syndrome. This one is pretty common. Most people have probably heard of it. It's a repetitive motion disorder caused by pressure on tendons and nerves as they pass through the carpal tunnel of the wrist, and you can see that pictured on the left there. Fibromyalgia. This is a chronic condition with widespread aching and pains in the muscles and fibrous soft tissue. It can be a little more difficult to diagnose, and treatment can be complex as well. Next, we have two more conditions, spasm and myorrhexia. Spasm, I know we all kind of know what a spasm is, but it's one of those definitions we don't see quite often. It's a sudden, involuntary, strong muscle contraction. Myorrhexis, that is a ruptured muscle, and you can see there's different grades of that. You can have a partial and you can have a complete, so many different types, and the severity of it would depend would lead to the type of treatment that would be necessary. Next, let's touch just briefly on muscular dystrophy. Muscular dystrophy is an inherited disease. It is a progressive muscle degeneration where the muscle actually atrophies. Here you can see a normal bicep on the left, and then you can see the bicep that has been affected by muscular dystrophy on the right. Next, we're going to switch gears and go right into our integumentary system. So the skin is the largest organ of the body. Often we forget about that. It receives more care and treatment than any other body system. The skin is just one part of the integumentary organ system. The whole system consists of the skin, hair, nails, sweat glands, and sebaceous glands. Let's talk about the functions of the integumentary system. The first is protection. The skin is a physical barrier against injury, chemicals, ultraviolet rays, microbes, and toxins. It's water resistance, meaning we don't swell up every time we take a bath because our skin is water resistant. It also prevents water from leaking out of our body tissues. Temperature regulation is an important function of the integumentary system. A network of capillaries in the skin opens up or dilates when the body is too hot. And when the body is too cold, the capillaries narrow, decreasing blood flow, and then the heat can be retained in the body. Vitamin D synthesis. So as little as 15 to 30 minutes of sunlight daily allows the skin cells to initiate metabolism of vitamin D, which is essential for bone growth and maintenance. And then sensation. Our skin has many nerve endings that detect touch, pressure, heat, cold, pain, vibration, and of course tissue injury. Excretion and secretion. Water and small amounts of waste products from cell metabolism are lost through the skin by excretion and by secretion from sweat glands. And then social functions, we forget about that, but our skin reflects our emotions. We blush sometimes. We go pale if we're frightened at times. We can wrinkle if we dislike something. Looking at our cross section of skin here, the epidermis is the most superficial layer of skin, and that's the one that your quiz focuses on the most. It forms a protective barrier. The word itself, if we would break it apart, means pertaining to above the skin. And again, it is the outermost layer of your skin. That's the epidermis. Another term to know is hypodermal. And oftentimes we think of a hypodermic needle. That word hypodermal just means pertaining to within the skin. Some more terminology related to the integumentary system. Onychophagia, that is the medical term for nail eating, chewing, or biting. Ecchymosis is a bruise caused by blunt trauma to the skin. And here we see a black eye, which doesn't normally occur unless we have some sort of blunt trauma. A few more to throw at you. Erythroderma, that means red skin condition. And here we see someone that has turned very red. Purpura, that's a type of bruise that occurs in a person with fragile skin. And a lot of times we'll see that in the elderly population. Lipoma. Lipoma is a fatty tumor. Alopecia, that is the medical term for baldness. We have one surgical procedure for you to know in terms of the integumentary system. Dermabrasion, and it's growing more popular, I would say. It's a surgical procedure that's often used to remove acne scars. Again, that's dermabrasion. One diagnostic treatment is a biopsy. A biopsy can be done almost on any part of the body, and it doesn't have to be just to evaluate an organ. It can be used to evaluate bone tissue, any kind of tissue within the body. It's a diagnostic procedure that examines any piece of tissue under a microscope, but first we have to harvest that tissue from the body. Next, let's move right into that cardiovascular system. So just some general reminders. Hopefully this is all knowledge you already have in your head. The heart receives blood from the veins and pumps blood into the arteries. The blood vessels are basically our transport system for blood. Arteries transport blood away from the heart. Capillaries, this is where the actual exchange of nutrients and waste products occur between the blood and the cells. They are very minute. They are also what join the arterial and the venous systems. Veins return blood to the heart. Again, the blood is the transport system to bring those oxygen and nutrients to the cells, and they also carry waste away from the cells. The area between the lungs that contains the heart is known as the mediastinum. Looking at your heart more specifically, there is a sac that encloses the heart. It does have two layers. It's called the pericardium. It's a double-wall membranous sac. The walls of the heart have three layers: the epicardium, the myocardium, and the endocardium. We have four chambers to our heart: two upper chambers known as atria and two lower chambers known as ventricles. We have several valves that take place throughout our heart: the tricuspid, the mitral, also known as the bicuspid, the pulmonary semilunar, and the aortic semilunar. And then we have arteries that supply blood to the actual heart, because the heart is just one giant muscle. And those specific arteries are known as the coronary arteries. Along with the heart, oftentimes we kind of go into circulation. There's actually two different kinds of circulation that occurs in our body: the systemic and the pulmonary. The systemic is the flow of blood to all parts of the body with the exception of the lungs. Pulmonary circulation is the blood flow between the heart and the lungs only. So there's the distinction between the two. In terms of systemic, blood leaves the left ventricle and it goes to the arteries. Veins carry deoxygenated blood back to that right atrium. The exchange of oxygen and nutrients, again, between the blood and the tissues of the body, that occurs in the capillary beds. Looking specifically at the pulmonary circulation, it is very unique. Pulmonary arteries, this is the only place in the body that the pulmonary arteries carry deoxygenated blood out of the right ventricle to the lungs. It's the only place in the body where the pulmonary veins are going to carry oxygenated blood from the lungs to that left atrium. One condition I want you to be aware of is cardiac arrest. Cardiac arrest is the term for a complete stoppage of all heart activity. One specialist you might already know in terms of the cardiovascular system, and that's a cardiologist. A cardiologist is a doctor who specializes in the treatment of the heart. One treatment that your quiz does focus on is coronary artery bypass graft, often abbreviated CABG. So this operation, coronary artery bypass graft, is where there's a blockage of a coronary artery and it's too severe to go through this skin and be able to manage it effectively. So they have to harvest a blood vessel from another part of the body and rebuild the blood supply to that heart muscle itself. At this point, it's your turn. And that concludes the highlights of the material. Definitely read through all 3 chapters for this week. If you have questions or concerns, reach out to me. You all should have my email address. That is the fastest way to get a hold of me. Our information from this week's presentation did come from your textbook. Again, I can't stress enough how important it is to read those chapters in their entirety. Thank you for your time this week and have a great week.